Hello everyone, welcome back. In today's episode we're going to talk about what is stroke ready center. Because we have been talking earlier, somebody is having a stroke or paralysis should reach to an hospital or a center where comprehensive stroke care facilities available, right? So what do you mean by that? What is a stroke ready center? But saying so, we mean that a medical center, a hospital where the comprehensive stroke care facility should be there. And what are the requirements? Number one, in the emergency itself, there should have a triage in place. There should have a complete assessment system in place. The doctors in the emergency should know that this sort of stroke patients is a time-dependent emergency. They cannot be made to wait for a long time in the queues. They should be given first preference because it is a time-dependent emergency, right? That's a very, very important thing. You cannot waste time in the hospital. Every minute counts there. That's number one. Number two, imaging facility. Imaging facilities, 24/7 imaging facilities is very, very important because somebody can come in the middle of the night. So the CT scan or MRI facility should be in place there. Number three, neurologist. Because they are going to assess the patient, they are going to scale the patient's how severe is the stroke. They are going to take a decision whether this patient is eligible for thrombolysis or thrombectomy. This is very, very important. Number four, provisions or facility for giving IV thrombolysis and thrombectomy as well. Because somebody is having a stroke because of clot, once we do the imaging, we find that this is because of clot and this patient's required clot busting medicines. We need to give that injection very, very urgently. Okay, so that is very, very important. That facility should be there. Other than this is in present, around the clock presence of a radiologist or neuroradiologist who can see the imaging and report it. That's very, very important. And the definition of a stroke ready center, so comprehensive ready center, is slightly there may be variations based on how much modernizations, how much what we are looking for. The basic requirement is what I have already told. In addition to that one, the centers to be called as a comprehensive stroke ready center should have a stroke intervention facilities in the term of, like, if it is a large clot, we say there is a large clot which is blocking a artery in the brain. The clot burden is high. So we need to have the facility so that the facility of cath lab or DSA lab, so that we can reach into the brain and take out the clot. Okay, the thrombectomy facility should be in place. You should have a stroke care ICU, or you should have a comprehensive stroke care team comprising of neurocritical team. Then you can have rehabilitation programs and other comprehensive team members should be in place. So this is what is required primarily to say to be labeled a center as a stroke ready center. It is very, very important because, as we were saying earlier, all over the world it is being giving an importance that you should reach to a center which is a stroke ready center. Why? Because the stroke treatment is time dependent. There is a golden hours. If you reach into the golden hours and treatment is being given within that golden hour, the chances of complete recovery is very good. Thank you very much.